So we're doing the algorithm for acromegaly. So when you have clinical suspicion of acromegaly, the first thing that you're going to screen for is the IGF-1 levels. A lot of people get confused here because they think that you have to look for the growth hormone levels, but that is not true. Now, depending on this, if it's elevated or normal, if it's normal, you just rule out acromegaly. However, if it's elevated, you do not go for the MRI. And that's a very common mistake people make. So the thing you have to do is go in for a oral glucose suppression test. Okay? Two things from here will arise. If you have adequate growth hormone suppression, then you automatically rule out acromegaly. However, if it is inadequate, growth hormone suppression, then we do the famous step of doing the MRI of the brain. And from here, two things can arise. Either you have a normal pituitary, and if you have a normal pituitary, you now have to evaluate the patient for extra pituitary causes of acromegaly. And remember, examples of this is ectopic growth hormone or growth hormone releasing hormone secreting tumors. Okay, that's if you have a normal pituitary gland after you do the oral glucose suppression test. After you do the MRI of the brain. However, if we see that the pituitary has a mass, there's two things you can do. Either surgical or medical management. That's all. That is the complete algorithm for acromegaly. Now the important part is when UWorld or First Aid Step 2 CK wants you to know things. Pretty much they want you to know exactly the same thing. However, in the initial treatment, according to UWorld, for most patients, it's a transsphenoidal resection of the pituitary adenoma. Okay? And if you have if a patient has residual unresectable tumors, then you use the following medical options, such as octreotide or pegvisomant. And that's what UWorld wants you to know. First Aid Step 2 CK wants you to just know three things right away. The treatment is surgery via the transsphenoidal resection, or also medical therapy which is via octreotide or lanreotide, and that is to suppress the growth hormone. And pegvisomant is to block the peripheral actions of growth hormone. And finally, if none of these work, meaning none of the medicinal therapies work or none of the surgical therapies work, then you will finally do radiation because everything else has failed. So that's very important for step 2. Notice that I did not explain why we check for IGF-1 and growth hormone and why we do this and why we do that opposed to other things. That is because, step 2 is very very heavy on what's the best management and what's the best next step, and this algorithm will help you get that. And honestly, I don't want to explain all the details within this. So hopefully this helps you guys. Thank you very much.